Hi, my name's Kara. I'm going to be your nurse today. How have you been feeling since your last visit here?
Hi, Kara. I've been fine since my last visit. My antidepressants and involvement in support and educational groups have, really helped most of my depressive symptoms.
Well, that's great to hear. What else has been bothering you and making you depressed?
Well, since you asked, I do have a 10-year-old niece who I absolutely adore, and I love spending time with her. However, her father, who's my brother, he won't let me around her since I smoke.
I can see how that can be frustrating. What other family do you have here in Columbia?
Well, it's actually just me, my brother, and my niece, his daughter. My mother lives in another town, and my dad actually passed away from lung cancer in his 60s. So.
Oh, wow. Well, I have a few questions that we ask all of our patients now regarding the use of various substances. How this can affect your overall health. Are you okay with talking about this with me?
I mean, I guess if everyone kind of answers them.
Okay. On average, how much do you smoke on a daily basis?
I smoke about 2 packs of Camel cigarettes without the filters a day. Why? Why do you ask?
Well, I'm just curious. At what age would you say you started doing this?
14. Everyone was pretty much doing it at that age, so.
Understandable. In the past 12 months, did you smoke pot, use other street drugs, or use a prescription painkiller, stimulant, or sedative for a non-medical reason?
No, just cigarettes.
Okay. In the past 12 months, did you ever think that maybe you should cut down on your smoking?
Yeah, I guess occasionally it would cross my mind. I was actually recently diagnosed with asthma, and sometimes I can't really catch my breath, so.
Okay. Have you taken any actions to relieve your asthma symptoms?
I've tried taking some medicines. They give me a little bit of relief, but I still kind of have random episodes of asthma attacks. I know quitting smoking probably doesn't help the cause, smoking probably doesn't help the cause, but I can't imagine quitting ever. That just doesn't seem, that seems crazy.
Well, do you mind if we talk more about your smoking?
Yeah.
Okay. You stated that you have smoked 2 packs of cigarettes without the filter since the age of 14. Is that about right?
That's right.
Okay. Can you tell me more about your smoking?
Yeah, well, I definitely feel pretty at ease when I am smoking. It's something that's just kind of become a part of my life, I guess. I don't want to quit or even try because I'm actually kind of afraid I'll just relapse right back into it and come depressed actually again. And I don't ever want to feel like that.
Okay. Well, smoking, especially 2 packs a day, is probably the reason why you sometimes experience these asthma attacks and the cough that has been bothering you so much. And since your father passed away from lung cancer, you are more at risk. So that I'm very worried about your health with smoking 2 packs a day. So I would like to offer you some advice and have you consider cutting back on your smoking. Would that be all right with you?
If you think that's the best, you're the nurse, so.
Okay. Due to your smoking patterns, you may be doing permanent damage to your lungs.
Oh.
Did you ever think about that?
No, I didn't realize it was that serious, actually. I just always keep thinking of depressive and suicidal thoughts and getting those out of my head, so.
I can understand why you would want to do that and be afraid of quitting your smoking because you want to get those ideas out of your head. Well, would you ever consider quitting smoking to improve your health?
Yeah, if you think that's the best.
Okay. Well, can you tell me about a time when your smoking affected your relationships with your family?
Yeah, well, there was this one time at my niece's birthday party. My brother caught me smoking at his house, and he kicked me out, and that was very embarrassing.
Well, in spite of what happened at the birthday party, you recognize that you were disappointed in how the event played out. So that is a very respectable thing.
Yeah.
How did you feel after the birthday party?
I just felt really embarrassed. The fact that I wasn't able to wait until I left the party to have a cigarette makes me feel terrible. I should have been there for my niece and shouldn't have been smoking.
Yeah, I can understand why that would be very embarrassing for you, but we can change that. And
Okay.
I can understand why it would be scary to consider quitting smoking, especially since you're afraid of falling back into depression.
Yeah, I want to be there for my niece as much as I can, so.
That's good. Have you tried to quit before?
No, I never really considered it.
Well, it does take a lot of strength to try and quit, especially by yourself, and I know change is hard. So from what you have told me, quitting smoking seems nearly impossible because you fear falling back into a depressive state. Is that right?
Yeah, that's right.
Could you give me a few reasons for why you would like to quit?
I mean, I guess I want to quit because it's going to make my overall health better. It can potentially, smoking can potentially shorten my lifespan, so that's not good.
Mhm.
But mostly I would like to quit so that I can be there for my niece, and so nothing is going to hold me back from that.
Mhm. Well, I know you didn't come here today to talk about your smoking, so I appreciate your willingness to do so with me. Would you be willing to discuss some of the pros and cons of your behavior?
Yeah, I don't see why not.
Okay. What are some of the things you like about smoking?
I smoke because it's a comfort for me. It relaxes me. It keeps the thoughts out of my head from hurting myself. So,
Well, that's good. Now that you've told me about what you like about smoking, can you possibly tell me what some of the cons are?
yeah, I think the biggest downside is that I can't visit my niece, and of course my health. So,
Okay. So what would be some good things that could come from changing your behavior and cutting down on your smoking?
I guess just making me healthier, expanding my lifespan, and then spending time with the people that I care about.
What are some of the not so good things about quitting?
Um, Becoming depressed again.
Okay, that's understandable. So now that we've discussed some of the pros and cons of quitting smoking, would you mind rating one out of a scale of 1 to 10 where you would be? 1 being the least likely that you're going to quit, and 10 being the most likely?
Maybe like a 5 or a 6. I don't know. I didn't realize I had a serious problem with smoking until now.
Mm-hmm.
I know it would be good for me to cut back or even quit, but I just haven't really thought about it before, I guess.
Okay. Well, why a 5 or a 6 as opposed to a 0?
I don't know. I haven't ever thought about how my smoking could be affecting my health and relationships, so
Mm-hmm.
maybe if I did smoke less, I'd be happier and healthier with my life, so it seemed like kind of midline was good.
Well, that's great. So it sounds like you're becoming more aware of how your smoking could be affecting your overall happiness. Is that right?
Yeah, I guess I am.
Okay. Well, what you said is important, and I want to make sure that I have it all right. So overall, you fear becoming depressed and possibly hurting yourself again. Is that what is causing you to continue smoking? And you don't like how smoking keeps you from seeing your niece and family. After discussing everything, you think it would be better for you to cut back or even quit because of how you realize how serious your smoking is and how much it is affecting your overall health. Is that about right?
Yeah, that sounds right.
Okay, great. Well, let's plan on following up in about 3 months. How does that sound?
That sounds good.
Okay. So would you be willing to try a couple of things between now and then?
Yeah, I think I'm ready to do that.
Okay. Do you have any family members or friends that you could ask for assistance during this journey?
Yeah, I mean, my brother, he would probably help me out. I think he'd be pretty supportive in the fact that I'm trying to change and quit and spend more time with his daughter.
Mm-hmm. Well, that's great that you have someone close that can assist you in this in reaching your goals. Could you also try to keep track of how many cigarettes you smoke per week?
Yeah, I can write down how many cigarettes I smoke per day in a diary or a journal or something like that.
That would be great. It would be a great tool because then you would always have it on hand. And so how about you keep track of the number of cigarettes you smoke for the next 3 months, and then we'll follow up after that. How does that sound?
That seems easy enough. I think I can do that.
Okay, great. Wonderful to hear. As you keep track of how much you smoke, let's try to limit your cigarette use to less than 1 pack a day. Some weeks may be much less, which would be awesome. But do you think that you could try to only have a maximum of 1 pack per day?
Yeah, I could definitely try that.
Okay. By the way, what are some of your favorite activities?
I don't know. I enjoy taking my niece to the park and teaching her new games, stuff
Okay.
like that.
Well, that's great. Maybe you can focus on that while you're trying to wean off of the cigarettes. How about that?
Okay, yeah.
Okay. To think at the beginning of this appointment that you were even contemplating that you weren't even considering not quitting smoking, and now that you are. So that is such a great step in this process. By reaching out to your brother, keeping track of how much you smoke, and cutting down to less than 1 pack a day, you're taking control of your smoking.
Yeah, I know. I guess I never really realized what was going on with my smoking until we talked about it today. And I mean, it seems kind of realistic and achievable, so I'm kind of excited to try it.
Well, that's great. Baby steps is what you need to do. And I'll make a note in your chart about trying to cut down to less than 1 pack per day, and we can see where we are when we follow up in 3 months. How does that sound?
Yeah, that sounds great. Thanks for your help.
Okay, great. No problem at all. Do you have any other questions?
No, I think that'll be all.
Okay, well, I'll be seeing you in 3 months.
Okay, thanks.
Thanks.